everyone, welcome back to our channel. My name is Brianna Wilson. I am a certified dementia practitioner and the founder of Bambu Care. So as you can probably tell from the video title, this video is going to be about what is dementia. So one of the biggest questions that I get is, what is dementia and how does that differ from Alzheimer's disease? So I first want to acknowledge the fact that dementia is not a disease. It's actually a syndrome. So it's a collection of symptoms that are caused by various diseases and conditions. Okay, so dementia itself is the symptom that's being caused by something else, other diseases, other conditions. So think of it this way. So hopefully you can see this okay. So let's think of a rash. A rash is a symptom, and it's usually red, bumpy, scaly, itchy type of patch of skin, okay? But there are different things that can cause a rash, right? So you can have an allergic reaction, and that can cause a rash. You can have an infection, and that can cause a rash. You can have psoriasis or eczema, and that can all those things can cause a rash, right? So in the case of dementia, dementia is our symptom, which is a loss of thinking, remembering, reasoning, and behavioral abilities to the extent that it interferes with daily functioning, okay? So what can cause the symptom of dementia? Alzheimer's disease can cause dementia. Okay, so Alzheimer's disease is characterized by plaques and tangles in the brain, which can result in dementia. Lewy bodies can cause dementia, so think of Lewy body type dementia. Parkinson's disease can cause dementia. Brain disorders affecting the frontal and temporal lobes can cause dementia. Think of frontotemporal type of dementia, okay? Changes in the blood flow in the brain can cause dementia. Think of vascular dementia. And alcohol abuse or B vitamin deficiencies can cause dementia. Think of Korsakoff syndrome that causes dementia. And infections can cause dementia. Think of Creutzfeldt-Jacobs disease, okay? That can cause dementia. So when we think of the question, how does Alzheimer's disease differ from dementia, the answer is that Alzheimer's disease is just one disease, one condition that can cause the symptom of dementia. So I know it's confusing because you often see things that say Alzheimer's and dementia as if they're two separate things. But really what they should say, to be more accurate, is Alzheimer's disease and other dementias, because there's so many things that can cause this symptom of dementia, okay? And a fun but not so fun fact is that there's actually over 100 different conditions and diseases that can result in the symptom of dementia. Now, the most common type of dementia is Alzheimer's disease, and that's why you see so much attention and media around Alzheimer's disease, because it's the most common, it's the most researched, and well known. Alzheimer's disease actually makes up about 2/3 of the accounts of dementia. Now let's go ahead and discuss some of the things that dementia can impact. Because unfortunately, many people think that dementia is simply just impairments in memory, some confusion, some impaired thinking, and so when these other things start emerging, they're in for a shocker because they didn't know that dementia could come along and impact so many things. So I'm going to go ahead and list them all out here so that you can look at them and read along with me, okay? So dementia can impact memory, abstract and critical thinking, problem-solving abilities, impulse control, judgment and insight, reasoning skills, planning skills, attention span, language skills, comprehension skills, behavior, personality, mood, coordination and motor functions, vision, perception, spatial skills, all of those things. Now, with dementia, the symptoms are usually gradual, and so they emerge over time. So, in the beginning, they usually can tell that something is a little bit off, but they don't too much worry about it in the beginning. They might contribute it to something like old age or being tired or something like that. But then things start getting more challenging for them. They start compensating for the things that they're beginning to lack and struggle with. But people around them might not yet be able to notice really anything out of the ordinary. But as the dementia progresses and it starts impacting their functioning and their daily activities, then those around them can notice that, something might not quite be right. But even still then, those around them, especially depending on that person's age, they might contribute it to something like old age, okay? So with that being said, there are a few things that I want to make sure that you know and understand, okay? So number one is that dementia is not a normal part of aging, okay? It's not. Now, it is common for there to be a slowing in thinking. So it wouldn't be out of the ordinary for someone to forget a word every once in a while, or to misplace something, or to forget that they've done something, or forget that somebody told them something, or they might even forget to do something, right? But I think we can all say that we've had that experience from time to time, right? But dementia is so much more than that, and it actually affects a person's daily functioning. With the slowing in thinking, which is a part of normal aging, it usually isn't severe enough to impact the person's everyday functioning. Whereas with dementia, it does, and that's not normal. That is not a normal part of aging, okay? The second thing that I want to make sure that you know and understand is that true dementia is progressive and it worsens over time. So unfortunately, with true dementia, it's only going to get worse. And that's because whatever disease, whatever condition is causing the dementia, it's doing so by slowly damaging and killing brain cells. So to put it quite plainly, the brain is slowly dying. And that is why dementia has such a profound effect on the person living with it, because it's affecting the brain, it's killing the brain, right? And when we think about it, the brain controls all of our functions. So as the brain dies, so will our functioning. Now, depending on the type of dementia, different things are preserved, and that's why dementia presents differently in some people, depending on the type of dementia that they have, okay? Because different parts of the brain are being affected and dying first, And so that's why it presents so differently. So that saying, when you've met one person with dementia, you've met one person with dementia, because it can vary because of how it's impacting the brain. The third thing that I want to make sure that you know and understand is that there is no cure or treatment for dementia. There's nothing that's going to magically take away dementia, true dementia. There are some pseudodementias, which we'll get into in another video. But with true dementia, there is no cure, okay? Now, with that being said, there are 5 FDA-approved drugs that help manage some of the symptoms of dementia. So some of the issues with the memory and the thinking and the attention, there are some drugs approved by the FDA to try to manage some of those symptoms. And of course, like any drug, they do come with side effects and they do have varying effectiveness depending on the person. So I'm going to go ahead and show you a chart of those 5. So we have Aricept, Razidine, Namenda, Exelon, and Namzaric. And the way that these drugs are categorized is by the stage of dementia that the person is in. That's how it's prescribed. And so the one drug that is okay for all stages and shows some type of effectiveness for all stages is Aricept, okay? But like I said, with any prescriptions, any drugs, there can be side effects and they do have varying effectiveness. Alright guys, so that wraps up this video. I just wanted to quickly go over some of the important things that I wanted you to know about dementia. And some of our future upcoming videos, I will go into more depth about different aspects of dementia as well as the specific different types of dementias. If you have any questions about anything that I covered in this video, definitely let me know, okay? But the one thing, if you took nothing else away from this video, the one thing that I want you to understand is that dementia is being caused by some disease that is triggering brain cell death, and the brain is slowly dying, okay? And I don't say this to scare you, but simply to inform you, because I truly believe that the more that you understand about dementia, the better you can prepare for it and be the best dementia care partner that you can be, okay? So I hoped you enjoyed today's video and learned something of value. Like I said before, if you have any questions, any comments about anything that we covered in this video, please feel free to reach out to me. And I will see you guys in the next video.